All right, the digestive system. The digestive system involves the alimentary canal and the accessory organs of digestion. And the major function is that the digestive system process food for absorption. When we say the alimentary canal starts at the mouth and passes through various regions and ends at the anus. So in this anatomical diagram, the alimentary canal starts from the mouth here, runs through the stomach to the small intestine, the large intestine, and the anus. So that's the alimentary canal. Then we now also have other accessory organs. If you check this diagram of the digestive system, the small intestine are labeled yellow, duodenum, jejunum, ileum, while the large intestine are labeled green. For level. So let's take a look at the functions of the digestive system. Number one, ingestion. And that this refers to the taking in of food into the alimentary canal. It's eating or drinking. We have propulsion. Propulsion is the movement of the content along the alimentary tract. When you swallow, peristaltic action moves the food along the alimentary tract. We have digestion. There are two types. We have mechanical breakdown. That's chewing. Anytime we say mechanical, you know that it must involve some physical work. So the mechanical breakdown is chewing. Then we have chemical digestion, which involves the enzymatic breakdown of food substances into small molecules. By enzymatic, it means that enzymes will digest the food. Food are usually large molecules and it requires enzymes to break them down. Okay. So we have absorption. After food has been broken down, then the nutrients are absorbed. They enter the systemic circulation or the lymphatic circulation, where the nutrient now moves around the body. Then we have elimination. It is the removal of undigested food as feces. The food that is not digested moves into the large intestine. If it's still not absorbed, then it passes out as feces. Okay? So let's talk about the alimentary canal. It's actually a long tube. The alimentary canal is also known as the gastrointestinal tract, and it is a continuous tube, approximately 9 meters in length. It includes the mouth, the pharynx, the esophagus, the stomach, the small intestine, large intestine, rectum, and the anal canal. So, we said the digestive system has two components, the alimentary canal or the accessory organs. So we have listed the components of the alimentary canal. Now we list the components of the accessory organs. These accessory organs, they include glands. And what they do is that they release secretions into the alimentary canal. So examples of accessory organs include salivary glands, liver, and pancreas. So let's now run through both the alimentary canal and the accessory organ. So let's talk about the mouth. The mouth is formed by muscles and bones. You know there are bones like the upper jaw and lower jaw, the maxilla and the mandible. Okay? Then it is formed anteriorly, or it is bounded anteriorly, meaning at the front, we have the lips. Posteriorly, at the back, we have the oropharynx. By the sides, laterally. That's what laterally means. It means by the side. We have the cheeks. By now, I expect that you are familiar with these anatomical terms. So by the side, we have the cheeks. Then at the top, we have the hard and soft palate. Then on the floor, we have the tongue and the floor of the mouth. Okay. The mouth itself is lined with mucous membrane. You know, we said the oral cavity or the open cavity are usually lined with mucous membrane, while the closed cavity are usually lined with serous membrane. Okay, so the mouth is lined with mucous membrane and it consists of stratified squamous epithelium. We already said it that anywhere that will be subjected to mechanical pressure or friction will be lined with stratified squamous epithelium. The vestibule is the part between the gums, cheeks, and lips. That's what we call the vestibule. Okay, so this is the upper lip. This is your soft palate, very close to your uvula. This dangling thing, when you open your mouth, that we see at the back, close to your throat, is what is called uvula. Then we have the palaryopharyngeal arch. Yeah. Then the tongue, the palatine tonsil, sorry, the palatopharyngeal and the palatoglossal arch. Okay. So now let's talk about the tongue. The tongue is composed of voluntary muscle. Okay. When we say voluntary, it means you can control it. You can roll your tongue. You can stick it out, stick it in, stick it out, bring it in. So the tongue is attached to the hyoid bone and the lower jaw, the mandible. The mandible is the lower jaw. And the tongue helps in chewing, swallowing, speech, and taste. It contains specialized papillae with taste buds. Now, the teeth. The teeth is also in the mouth. There are two types of teeth. You have the temporary, otherwise known as the deciduous teeth, and it's 20. There are 20 in total. Then we have permanent teeth. There are 32 in total. Okay, so this is the maxilla, the upper jaw. Then you can see the teeth. Then we have the mandible. Here we have the temporomandibular joint. Now, okay, so here is just showing us the type of teeth and the arrangement. So if you see this is showing us picture A is the lateral view of deciduous teeth. Okay, and we have buds of permanent teeth inside the gum that will come out as the child begins to mature. Okay, so molar in either region is 2. So we have two upper right, two upper left, two lower right, two lower left. So making 8. Total is 8. So, but this table is showing us the distribution of both deciduous and permanent teeth according to their types. Okay. So what you must note is that in deciduous teeth, temporary teeth, the molar is 2. Okay. Then, or the molars are 2. Then we have 4 regions: upper right, upper left, lower right, lower left. So that makes it 8. The canine is 1. Then we have 4 regions. That's 1 times 4. That makes it 4. We have 8 molars, 4 canine, making 12. Then the incisors too is 2. 2 times 4, 8. So 12 plus 8, we have 20. That's how we come about 20. There are no premolars in temporary teeth. There are no, please take note, there are no premolars in deciduous teeth. Okay. Then for the permanent, we have 3, 2, 1, 2. So you multiply each by 4. In permanent teeth, we have 3, 2, 1, 2. From molar, premolar, canine, incisors. So each figure I've quoted, you multiply by 4. So molars 3. 3 times 4, that's 12. Premolars 2. 2 times 4, that's 8. 12 plus 8 gives us 20. Canine 1. 1 times 4 is 4. So 20 plus 4, that's 24. Incisors is 2. 2 times 4 is 8. So 24 plus 8, we have 32. Now, the visible part of the teeth is called the crown, and the root of the teeth is embedded in the gum. Okay? Then, the neck is where the crown and the roots meet. Then, in the pulp cavity of the teeth, of the tooth, we have blood vessels and nerves. So layers. The outer hard part is called the enamel. Then inside the enamel, we have the dentine, which is beneath the enamel, and it forms bulk of tooth. Then the pulp, the innermost part, contains nerves and blood vessels. This is the structure of the teeth. We have the enamel, the hard white part, which also constitutes the crown. Then inside it, we have dentine. Then inside dentine, we have pulp cavity that contains blood vessels and nerves. And this is the gum. Then we have the neck of the teeth. We have cementum. This is inside the gum. Okay. Then we have the root. The root of the tooth, like I have said, is the invisible part, is inside the gum. So the individual type of teeth, this is what it looks like. So what are the functions? Incisors and canines are for cutting and tearing, while premolars and molars are for grinding and chewing. Now, salivary glands. We also have salivary glands in the oral cavity in the mouth region. There are majorly 3 types. We have the parotid gland. The parotid gland is located near the ear. And we have the submandibular glands. These are located beneath the lower jaw. You know, mandible is lower jaw. So when we say sub, that's on beneath the lower jaw. Then we have sublingual glands. These are located under the floor of the mouth. Now, so what are the functions of the salivary gland? The salivary gland is also a type of exocrine gland, not an endocrine gland, unlike the endocrine gland that secretes into the systemic circulation. Exocrine glands secrete into ducts. So what are the functions of the salivary glands? We have production of saliva, and the saliva contains water, enzymes like amylase, lipase. We have mucus, and we have antibacterial substances. Saliva aids in digestion. It also helps to lubricate food, and it helps the circulation of the saliva helps maintain oral hygiene. Okay, so this is a pictorial representation of the salivary glands. Here we have the parotid gland, and here we have the submandibular gland, and here we have the sublingual gland, which are all salivary glands. What are the functions of the saliva? We have chemical digestion. The saliva contains amylase for the breakdown of polysaccharide or carbohydrates. So the digestion of carbohydrate starts in the mouth. The saliva has a pH that ranges between 6.5 to 7.4. So saliva is slightly alkaline. Like we have said earlier on, it lubricates food for easier swallowing. And it helps to keep the mouth clean and protect against bacteria. And then it aids in the dissolution of chemicals, which allows us to sense taste. So when we move from the mouth, we get to the pharynx. The pharynx is divided into three parts. We have the nasopharynx, oropharynx, laryngopharynx. The nasopharynx is important in respiration. Oropharynx and laryngopharynx are common to both the respiratory and digestive systems. And the pharynx is also lined, like the mouth, with stratified squamous epithelium. And the pharynx contains muscles and glands for swallowing and protection. So from the pharynx, we move to the esophagus. The esophagus is approximately 25 centimeters long and is about 2 centimeters in diameter. It lies in the median plane in the thorax, the chest, in front of the vertebral column, and behind the trachea and the heart. The esophagus continues with the pharynx above and joins the stomach below the diaphragm. So let's talk about the anatomical features of the esophagus. We have the upper esophageal sphincter, and this controls the entry of food into the esophagus. We have the lower esophageal sphincter. It prevents the backflow of gastric content into the esophagus. In fact, this is particularly essential in preventing gastric esophageal reflux disease. Okay. So functions of the mouth, pharynx, and esophagus. One, we have formation of a bolus. Food is chewed and mixed with saliva to form a bolus. The bolus is moved to the pharynx by the tongue. Now, swallowing. Swallowing is also referred to as deglutition. There are three stages of swallowing. We have the oral stage, pharyngeal stage, and the esophageal stage. The oral stage, we have the voluntary stage where the bolus is pushed into the pharynx. Then once the food gets into the pharynx, involuntarily, without your control, you get pushed into the esophagus. So the pharyngeal stage is an involuntary stage where the bolus is pushed into the esophagus. The esophageal stage too is an involuntary stage where peristaltic waves move the bolus into the stomach. Okay, so the oral stage, pharyngeal stage, esophageal stage, it's only oral stage that is voluntary. The remaining two, they are involuntary. Then when food gets to the esophagus, it moves into the stomach via peristalsis or via peristaltic action. So like I said, I've already given you this. I said gastric reflux, meaning the movement of the stomach content back into the esophagus and to the trough. Okay. The reason why this is not good is because when you eat, your stomach, the stomach releases hydrochloric acid. So if the content of the stomach moves back into the esophagus, we have gastric reflux or gastroesophageal reflux disease, which can cause heartburn. Okay, so the lower esophageal sphincter constricts or closes to prevent reflux of gastric acid. Excuse me. So let's talk about the muscles involved in chewing and swallowing. We have various muscles, and these include the temporalis, masseter, buccinator, and they play a role in chewing and moving the bolus. This is our temporalis. You know, when I took you on the skeletal system, we said the bone here is in this region is the temporal bone. Okay, this is the frontal, this is the parietal, this is the temporal. So the muscle attached here is called the temporalis. Then this is the masseter. Then this is the buccinator. Okay, now this muscle, when you chew gum, in no time, when you chew gum for long, to start paining you, this temporalis muscle, to show you that it's also involved chewing. Okay, so let's discuss the stomach. The stomach is actually a J-shaped, and it's also dilated like a balloon, okay, of the alimentary tract, and is situated in the epigastric, umbilical, and left hypochondriac regions of the abdominal cavity. So at the front of the stomach, we have the liver and the anterior abdominal wall. At the back, we have the abdominal aorta, we have the pancreas, we have the spleen, we have the left kidney, we have the adrenal gland. You know, the stomach is tilted more to the left part. Then superiorly, we have the diaphragm, esophagus, and left lobe of the liver. Inferiorly, we have the small intestine, and transverse colon. Then to the left, we have the diaphragm and spleen. These are just some of the organs that surround the stomach. Then to the right, we have liver and duodenum. Because now structure. The stomach is continuous with the esophagus at the lower esophageal sphincter, and it continues with duodenum. The duodenum is the first part of the small intestine. So the stomach continues with the duodenum at the pyloric sphincter. So there are two sphincters, the lower esophageal sphincter. After it, we have the stomach. And after the stomach, we have the pyloric sphincter. And after the pyloric sphincter, we have the duodenum. Okay? Okay. Now, regions of the stomach, we have the fundus, that's the upper part. This is the fundus. Then we have the body, the main central region. Then we have the pylorus. And the pylorus has the pyloric sphincter that regulates passage of food into the duodenum. The largest part of the stomach is the body of the stomach, not the fundus, not the pylorus. Okay. So the stomach, like we have said, produces gastric juice, and 2 liters of this gastric juice are secreted daily, and it consists of water, mineral salt, mucus, hydrochloric acid, pepsinogen, and intrinsic factor. Again, our gastric juice contains like six components. We have water, mineral salts, mucus, hydrochloric acid, pepsinogen, and intrinsic factor. What are the functions? Hydrochloric acid, it provides the acidic environment for enzyme activity. Then we have pepsin. Pepsin is the enzyme that breaks down proteins. Mucus. Mucus protects the stomach lining, while intrinsic factor is essential for vitamin B12 absorption. So let's go over this again. The gastric juice that is produced by the stomach, about 2 liters every day, consists of water, consists of mineral salts, consists of water, consists of mineral salt, consists of mucus, consists of HCl, consists of pepsinogen, and it consists of intrinsic factor. So we said the HCl, the hydrochloric acid, provides an acidic environment for enzyme activity, while the pepsin is the enzyme that breaks down proteins. To tell us, I said the digestion of carbohydrates starts from the mouth, while the digestion of protein starts from the stomach line. The intrinsic factor is essential for vitamin B12 absorption. So, how is this our gastric juice produced? There are 3 phases. We have the cephalic phase. This cephalic phase is usually triggered by sight, smell, taste, or thought of food. When you smell food, or when you think about food, or when you see food, it stimulates the vagus nerve to release gastric juice. Now, then we have the gastric phase. After you have now eaten, this gastric phase is triggered by the presence of food in the stomach, which stimulate gastrin release and further secretion of gastric juice. Then we have the intestinal phase. The intestinal phase is triggered by the presence of partially digested food in the small intestine, leading to the release of hormones that inhibit gastric secretion. Functions of the stomach. Storage. It stores food. It allows time for the digestive enzyme to act. Digestion. Proteins are broken down into polypeptides. Mechanical breakdown. The muscular layer of the stomach churn the food. Churn means like grind, and mix it with gastric juice. A, a little absorption also takes place in the stomach. Then protection. The stomach also secretes mucus to protect against the acidic environment and enzymes. So the stomach controls the passage of chyme into the duodenum